Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Do I need stitches for this wound? If you've had an injury, you may wonder whether it's going to require stitches. This will depend on the type of wound, cause, other conditions you may have, and whether stitches are the treatment of choice. Make sure to take care of the wound until you can get professional help. /r/n/r/n This article discusses the types of injuries that might require stitches, explaining when wounds can and cannot be helped by stitches. It also lists reasons to contact your healthcare provider whether or not you have a wound sewn up. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Stitches are used for two reasons. /r/n/r/n Let's look at the second reason first. If the wound is in an area where scarring would be obvious and the wound is deep enough to see the fatty tissue under the skin surface, the subcutaneous tissue, then getting stitches may allow you to have a less obvious scar. Talk to your healthcare provider if you're concerned about scarring. /r/n/r/n The first reason is more complicated and requires a bit more understanding of the types of wounds, how they are treated, and possible infections. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Verywell, Todd Fergusonrnrn Wounds that cause a break in the skin are called open wounds. These are the types of wounds that may require stitches. Closed wounds do not have a break in the skin and are identified by swelling and bruises. /r/n/r/n There are several types of open wounds. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Reader submission /r/n/r/n These are the wounds that should always be seen by a healthcare provider. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Verywell, Todd Fergusonrnrn Lacerations, punctures, and incisions are all suturable wounds. They can be stitched. Avulsions that still have a flap of skin attached may also be suturable. Complete avulsions and abrasions cannot be stitched, but you still may need a healthcare provider to treat the wound if it's serious enough. /r/n/r/n To determine if stitches are needed, look at three things: /r/n/r/nHailshadow, Getty Imagesrnrn The final but not least concern is how long it's been since your last tetanus vaccination. A booster tetanus shot is recommended every 10 years unless you get a dirty wound. /r/n/r/n Ultimately, if you're concerned about the wound and unsure whether it needs professional attention, then see a healthcare provider. /r/n/r/n Getting stitches means having a wound sewn closed with a special medical thread. This procedure can help an open wound heal and may minimize scarring. /r/n/r/n Only cuts and puncture wounds that are deep enough need to be stitched by a healthcare provider. You might need to see a healthcare provider even if you don't need stitches, though, especially if you have diabetes. Other situations in which you should see a healthcare provider regardless of whether you need stitches include being bitten, dirty wounds, and wounds that won't close or stop bleeding. Talk to your healthcare provider about whether a tetanus shot is needed as well. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.